Humphrey field analyzer is an automated perimeter intended to identify visual field defects. The purpose of this video is to provide procedure instructions useful for operating the instrument and testing the patient while monitoring the screen. To quickly find a patient, type the ID number in the search field and select the search icon. Select the patient from the resulting list. If the patient is not in the database, create a new patient record. For a new patient, fill in the last name, first name, ID number, gender, and date of birth. Patient's age will appear once date of birth has been entered. Move the trial lens into an upright position from its storage position in the bottom of the bowl. Place the spherical lens in the slot closest to the patient and the handle to the right for the right eye and to the left for the left eye. Place the cylinder lens, if indicated, in the slot farthest away from the patient and align the axis. To facilitate patient positioning, the chin rest is divided into two cups, one marked with blue for the right eye testing and other marked with white for the left eye testing. Enter the distance prescription values manually. The trial lens value is automatically calculated based on the distance prescription and the patient's age. Select a test from the test profile and parameters menu to select a new test parameters. The new test profile, pattern and strategy will then be displayed. Use the perform test to select which eye to test. By default, both eyes are selected. Enter intraocular pressure, pupil size and visual acuity. Confirm test information and select the next button to proceed. Occlude the non-test eye. Position the patient to place chin on the appropriate side of the chin rest and instruct the patient using the instructions shown on the screen. Give the response button to the patient and explain the procedure. If one chooses to perform the foveal threshold testing, the perimeter will automatically illuminate the smaller diamond fixation option. The patient should be instructed to look at the middle of the small diamond. To proceed without this test, select a skip foveal threshold. At the completion of foveal threshold test, the perimeter will switch back to the central fixation target. The patient should be instructed to switch their fixation to the central fixation. To perform gaze initialization, make sure to adjust the eye position and read the on-screen instructions to the patient. To proceed without this test, select Skip Gaze Initialization. If gaze initialization fails, a pop-up message provides the available options. Give the response button to the patient and explain that they can blink normally. During the test, they should look straight ahead at the steady yellow light in the center of the bowl and without moving the eye, press the response button when other lights flash one at a time at the side. Ask the patient if the fixation light is in focus. Tell them that they are not expected to see all the lights and there will be sufficient time to respond. If they are tired or uncomfortable, they can pause the test by holding the response button down. It is important to align the patient's eye to the center of the trial lens. A red X indicates the pupil location when it is not centered. A green plus sign indicates the center of the lens position. The X of the pupil location turns green when it is centered and overlaid with the green plus sign of the lens. The resulting centered icon looks like a green star. An on-screen progress bar along the bottom of the screen provides the graphic result of the test progress and records the relative magnitude of gaze errors if the gaze tracking is active. Stimulus responses are recorded on the bar. To the right of the progress bar is the elapsed time. Gaze errors are recorded as red marks at the time point that the gaze error occurred. Upward markings indicate that the test eye deviated from the fixation target at the time of stimulus presentation. The higher the marking, the greater the deviation. Downward marks indicate that the system was unable to determine the gaze either due to the blinks or other reasons. Is test points in numerical values. Reliability indices are shown in the upper right of the screen. In Sita test, false positives are not calculated until the end of the test. When the test for the eye is complete, a message is displayed. Test the second eye following the same procedure. The software will give an audible alert to the user if a fixation loss occurs and 3 or more of the last 10 fixation checks have been errors. Review results display the test results for each eye tested. Selected reports will automatically be printed based on the configuration set for the instrument. Or the test results can be selected for the printout.